Hello, good afternoon, everyone. As you all know, my name is Valerie, and I am making this video for my public speaking course. I am going to be talking about the health and risks of pregnancy. I will be mostly focusing on the risks that come with pregnancy, and there is a reason for that, and I'll get to that later in the speech. So, as you all know, pregnancy is a beautiful thing. But with this beautiful and amazing experience comes many risks. And there are certain important risks that a woman, especially a pregnant woman, should look out for during her pregnancy. I have found 6 most common complications during pregnancy, and these are very important to look for, especially if you're pregnant. These complications include high blood pressure, preeclampsia, preterm labor, miscarriage, stillbirth, and gestational diabetes. So when it comes to high blood pressure, and a pregnant woman has high blood pressure, she should speak to her doctor right away, and they should come to an agreement on what medications would be safe for her to take while she's pregnant. High blood pressure can lead to more complications in the pregnancy, and these complications can include, like I mentioned before, preeclampsia and miscarriages, and many more. Now, with diabetes, it's a little more complicated. Pregnant women who have gestational diabetes should be placed on a healthy diet. They should exercise, and they should be placed on daily sugar monitoring. And when I say exercise, I don't mean excessively exercise. There are a lot of women that have exercised before, and that's okay, perfectly fine, and it's healthy for them even to continue that type of exercise, just a little less heavy or less extreme that they used to do. And it's especially important to talk to their doctor before they try to go back to the gym or their workout class and continue that type of exercise. So you guys might ask how gestational diabetes affects a mother and the baby. Well, gestational diabetes for the mother means that later after the pregnancy, the mother can develop type 2 diabetes in the future. For the baby, it means that he or she is susceptible to respiratory distress syndrome, meaning it's going to be difficult for them to breathe, and they can be susceptible to hypoglycemia after birth, immediately after birth. So hypoglycemia is low blood sugar. Now, I want to talk about preeclampsia. So I mentioned before how high blood pressure can lead to preeclampsia. Preeclampsia can lead to severe and even fatal complications for the mother and the baby. It's very important to talk to your doctor about this and to take any medications that you might have the okay to from your doctor to avoid this. Preeclampsia can be resolved as quick as a couple days, even up to I think about 2 weeks. With preterm labor, there are many symptoms to look for. I'm not going to name them all, but most of the symptoms include contractions, and these contractions can be different depending on the stage of your pregnancy, meaning if you're on your second trimester, you might experience a different type of contraction. It might feel just like mild cramps, which is another symptom to look for. And for a mother who's in the third trimester, it might feel a little different. So more symptoms would include low backache, low abdominal pressure, uterine and placental problems, and this one's very important, which is spotting or bleeding. If a pregnant woman experiences any of these, it is very important for them to go to the doctor or rush to the ER right away. Now, there are also many risk factors aside from symptoms that lead to preterm labor. These risk factors include previous preterm labor, meaning you've had a preterm labor before and this is your second or third pregnancy, and you are more at a higher risk to go through preterm labor again. Shortened cervix, pregnancy with multiples meaning like twins, triplets, quadruplets, smoking cigarettes, alcohol and drug abuse. Very important to stay away from all of that for the safety of your baby and for you. And again, uterine and placental problems is a big one as well. It is very important to talk to a doctor and do your research about these risk factors to try and prevent preterm labor. Now, all of these, except gestational diabetes, but the others, can lead to miscarriages and stillbirth. So I have this right here that I printed, a picture of miscarriages by maternal age. So as you can see, at 18 years old, it's very low. It's at 10%. But the older you get, the higher the percentage increases, meaning you're more susceptible to miscarrying a child in your mid-40s or late 30s. As you can see right here, from 38 to 43%, it's up at 38 to 43 years old, it's up to 80% right there. And I have this one right here about stillbirth. So for stillbirth rates, this one down here shows the US stillbirth rate from 1950 all the way up to 2006. As you can see, it's gotten lower with time, which is very good. Very, very good. And up here, you can see the stillbirths in the world every day. So right here shows the number 7,177 stillbirths every day around the world. And it shows different types of countries with the amount of stillbirths they have every day, showing Indonesia at 201, Ethiopia at 264, China at 335, and the highest country, and it still is the highest country with stillbirth rate, is India. Right here it shows that they have a stillbirth rate of 1,622 a day. As you can see here, the miscarriage rate just basically goes up with age. So it's very important to think about getting pregnant sooner rather than later for the health of you, for your health and for your baby's health. It can be very fatal for the mother and for the baby as you get older and you decide to get pregnant. I wasn't able to find a good picture or statistics that say the miscarriage rate per year in the US, but I was able to find something that was close, saying that every year in the US, a couple million miscarriages, not induced abortions, just miscarriages, happen in the US every year. A couple million. For stillbirths, there are 24,000 stillbirths every year. This affects 1 in 160 births. So it's very, very horrible thing to go through, and it's very important to get educated on it. Now, going back to what I mentioned before about preterm labor and how it can further complicate future pregnancies, I would like to share why I chose this topic in particular and my story. When I was about 23 or 24 weeks pregnant, I went into preterm labor. So I went to my doctor's appointment, regular doctor's appointment, to go see, basically it was like a checkup on my cervix and the baby and everything. And the sonographer wasn't able to find my cervix. He wasn't able to see it. My baby was in the way and he wanted to measure it. He wasn't able to see it with a regular ultrasound, but he was then able to do a vaginal ultrasound and saw something. I remember he told me to get dressed, meet him in another room, and he went to go get the doctor right away. When he got the doctor, she walked into the room and right away let me know that my daughter was at risk of dying. And there was a 50% chance they could keep her inside a little longer, or she would have to come out and basically not make it, or she would just have a lot of problems. I was placed in Trendelenburg, which means they have you lying down but like this, so that way there's no more pressure on my cervix and I won't keep dilating, because I was about 4 centimeters dilated. I was rushed to the hospital and I wasn't even able to walk because they didn't want me to put so much pressure. I was put in Trendelenburg again once I got there, and I was rushed into surgery. I had a cervical cerclage placed. Luckily, I still had enough, like my cervix wasn't as short. So she was able to place a stitch, and a cervical cerclage basically is like a stitch to hold your cervix closed so the baby could last longer in there. And luckily, I still had something left for her to grab onto so she could place that stitch and basically save my baby's life. My pregnancy from then on wasn't a normal one. I was on strict bed rest. I spent the next 4 months laying in bed and terrified to lose my daughter. After she was born, she spent 2 weeks in the NICU because I got my cervical cerclage removed at 36 weeks, and a couple days later she was born. So she spent 2 weeks in the NICU, and she had many problems. I can't even remember, but I know she was septic and she had a lot of breathing problems. Her heart rate was constantly going up. She had a hard time swallowing. She would stop breathing because she didn't know when to stop eating. So she was still learning how to do all that, and there was a lot of scary moments. But one day she miraculously was okay, and I was able to take her home. and she's now strong and healthy, and I don't know, the brightest little girl I've ever met. And for me, it means that from now on, with any pregnancy I have, I can be susceptible to miscarriages. So the next time I decide to get pregnant, I need to basically be on strict bed rest for the entire pregnancy. And if I do make it past the 3 months, I have to have a cervical cerclage placed again on me if the baby does make it past the 12 weeks. If not, then I basically suffer miscarriage. And after the cerclage, again, on strict bed rest until my baby's born, which is very difficult because during pregnancy, you know, a lot of mothers want to do the photo shoots and do all these different things. And for women like me who suffer from what I'm suffering, we aren't able to do that. We aren't able to experience that. And it's very scary because you are at a high risk of losing a child after you suffer from cervical incompetence. So I went online and I did some research. After a while, I was able to find an organization called March of Dimes. So March of Dimes has a lot of information on causes and prevention of preterm birth. Again, this organization is called March of Dimes if anybody wants to look into it. So now I can only ask for women, and especially pregnant women, to do the research and to educate themselves and educate their friends and their family about the health and the risks that come with pregnancy, because as beautiful as it is, there are many risks. Also donate to these programs and organizations, because they do help women to get more educated on the subject, and it's very important, and it can make a big difference. So thank you for watching my video, and good night.